The Tuskegee Study of Syphilis was a study conducted on Black males in the United States between 1932 and 1972 on the effects of untreated syphilis. The participants were picked because of their color and their vulnerability because they lived in a lower socioeconomic area. They were not informed on what the research entailed and the lack of treatment. In 1943, penicillin was the treatment for syphilis but was not offered to participants. Some of the ethical and legal issues that arose from this research trial was the lack of informed consent. The subjects were not fully informed about the research and the potential consequences of not receiving treatment. Another ethical issue and legal issue that arose was the withholding of the treatment. At the time, there was limited research on the effectiveness of penicillin in treating syphilis. Instead of allowing the subjects to make their own treatment decision, they were not given the option and they were led to believe that they were getting the best treatment they could. Another ethical issue that arose from this research trial was the subject selection. The researchers chose males from low socioeconomic background who had limited access to health care and were in a vulnerable position. The study also disregarded laws. In 1927, it was required by law in Alabama to report the treatment of venereal diseases, but it was not done as it required. The significance of this case is that it put a spotlight on ethical and legal issues regarding research on human subjects, and it also led to better research practices and policies such as the National Research Act and having better regulations on informed consent requirements. To dive a little deeper into the significance of this research trial, we look at the National Research Act, Informed Consent, and Privacy. The National Research Act in 1974 created a commission for human research trials. The commission created guidelines for research and also the criteria for informed consent. Informed consent became a requirement in research trials, which required researchers to inform participants on the purpose of the research, their role in the research, how the trial will work, and any risks or benefits involved. And privacy also became a requirement in research trials, which meant keeping health information private and limited to the scope of the research in conducting research in a private setting. This was an image that I came across while I was researching the Tuskegee trials. One of the things I found interesting was that the participants in the trials were offered medical treatment and free meals as an incentive to participate in the trials, but in reality, they were not receiving the treatment they should have received for having syphilis. This research study had quite the impact on society. It led to medical mistrust and mortality among African American men when this research trial was first released to the public, and the lack of ethical and legal guidelines were brought to light. It also shed a light on health disparities and health inequality within different demographic areas. It also led to better research practices among the medical staff, which was a positive that came out of this study. The impact that this research trial had on healthcare professions is that it led to having better policies on informed consent, and it also led to professionals being held to a higher standard and having ethical guidelines in place to prevent these sort of trials from occurring again. These are a few of the ways that we can mitigate risk and ensure that we're following legal and ethical guidelines in human research trials. One of those ways is to evaluate the risk and the burden of research. Are the benefits of the research worth the risks that may be involved to the participants? And then having fair subject selection, meaning having participants that are chosen unbiased without race, economic status being a factor in subject selection. Having informed consent means making sure that participants are aware of what the research involves, what the risks and benefits are, and what their role in the research would be. Having an independent review would help ensure that researchers are following legal and ethical guidelines because they would have an outside source peer review their research study, and then following human research and ethics standards, and then lastly, having patient privacy and welfare at the forefront of any research study. I think it's important that we remember that any research we're doing is to help advance the medical field and provide better care to patients. And if we forget that, that's when we fall into situations like the Tuskegee case where we are letting humans suffer instead of treating them for syphilis when there is a treatment available. And then these were just some of my references, and if you wanted some further reading, these are some great articles that go a little further into the Tuskegee study.